Hello, this is a presentation on seasonal allergies by Dominic, Kenny, and Andy. So first off, how do allergies work? Allergies are when your body's immune system, the thing that helps you fight off sicknesses, overreacts to something normally harmful. Common allergies include pollen, dust, and animal dander, things commonly in the environment. When your body's immune system gets triggered by an allergen, it sends antibodies to fight it off and releases a chemical called histamine. Histamine is what causes your eyes to itch and your nose to run. Basically, all the symptoms you associate with allergies. So next, how severe are my allergies? Allergies are considered moderate to severe if they cause you to have trouble sleeping, trouble performing your activities of daily living, such as working, or symptoms you find overly troublesome. Otherwise, they're considered mild. Allergies are considered persistent if you experience symptoms at least 4 days a week for at least 4 weeks. Otherwise, they're intermittent. Determining how severe your allergies are helps figure out the best treatment for them.
So some fun facts about allergic rhinitis. Did you know? Allergic rhinitis is often referred to as hay fever. It affects about 6.1 million of the children population and 20 million of the adult population. In 2015, white children were more likely to have allergic rhinitis than African American children. Immunotherapy such as allergy shots helps decrease symptoms in around 85% of patients with allergic rhinitis. In 2007, there were 13.4 million visits to clinics, doctors' offices, emergency departments, and hospital outpatient departments that had a primary diagnosis of allergic rhinitis. So some non-farm therapies that you can do to prevent seasonal allergies would be to avoid the allergen. So helpful tips would be to stay inside when the pollen is high outside. You can keep your windows and doors shut. You can use HEPA filters, which is high efficiency particulate air filters. The way these filters work is that they force air through a fine mesh and it traps the bad particles like pollen, pet dander, and dust mites. Another thing you can do is avoid the dust mites. You can clean your carpets, wash the linen at least once per week, and reduce humidity. You can also avoid pets. You can avoid the allergen and limit exposure to whatever is causing the allergies, like cigarette smoke, pets, pollutions, or any of the allergens that are causing the sensitivity. So some more non-farm things that can be done is allergy desensitization, like allergy shots, nasal irrigation, which uses isotonic or hypertonic saline. It helps with runny noses by helping to alleviate the nasal irritation and removing the thick, crusty mucus. It can be done with a neti pot, saline spray, or low-pressure squeeze bottles. But you want to always avoid using tap water as that can lead to infection. Another thing that people sometimes use is acupuncture. The precise mechanism of the action is unknown. Advocates propose that it's related to the release of neurotransmitters that are involved in regulating the inflammatory pathways which cause the seasonal allergies. However, there's currently not enough evidence to support or counter the use for seasonal allergies. Probiotics are also sometimes used, but there's currently very limited data for its efficacy in seasonal allergies. There were 12 studies that were done to evaluate its effect in seasonal allergies, but they had mixed results. And herbal supplementation. So the effectiveness and safety of various herbal and plant extracts have not been established for the treatment of allergic rhinitis, but they are still commonly used.
The first line for pregnant women is going to be intranasal cromolyn, diphenhydramine, or chlorpheniramine. And remember, if something has worked before in the past, you should always go for that option. Also for lactating women, you can use inhaled corticosteroids. However, it can pass into the breast milk, so it's important to contact your doctor before use of any over-the-counter products. So when should you visit your doctor? So for children younger than 12, you should always visit the doctor before using any over-the-counter allergy product. Also, pregnant women and women who are breastfeeding should also consult with their doctor. If you are suffering with symptoms of seasonal allergies for more than 3 months, you should visit your doctor. When you've tried multiple over-the-counter products and they're not providing any relief, you should also visit your doctor. If you're experiencing any sleep difficulties due to the allergies, such as insomnia, breathing difficulties, or snoring, you should visit your doctor. And if you have a past medical history of lung disease, such as asthma, COPD, or if you have a history of sinus infections, stuffy nose, infections, or any other chronic medical conditions such as heart disease, diabetes, glaucoma, high blood pressure, liver disease, kidney disease, enlarged prostate, or any immunodeficiencies or autoimmune disorders, you should always visit your doctor before using any over-the-counter allergy medications. So now we're going to go over the over-the-counter oral antihistamines. So there's two classes of these medications, first generation and second generation. The first generation antihistamines are diphenhydramine, clemistine, brompheniramine, and doxylamine. These can cause drowsiness and confusion and are generally not recommended for seasonal allergies due to those effects. The second generation oral antihistamines are going to be loratadine, cetirizine, levocetirizine, and fexofenadine. These drugs do not cause drowsiness generally. They are first line for mild seasonal allergies for most people, and they typically work within 30 minutes. The mechanism of which these drugs work to stop seasonal allergies is that they stop the histamine from being released and causing the allergies in the first place. So the first second generation oral antihistamine that we're going to go over is loratadine, which is the generic name, and the brand name is Claritin. So the dose of this medication is going to be 10 milligrams by mouth once daily, and the max daily dose that you can take is 10 milligrams. Side effects of this drug are going to be dry mouth, headache, drowsiness, and fatigue. And you want to have a caution, particularly in patients with liver and kidney impairments, as well as pregnant patients. This drug comes in tablet form, chewable tablet form, liquid-filled capsules, as well as oral disintegrating tablets and oral solution. So the next second generation oral antihistamine that we're going to go over is cetirizine, which is the generic name, and the brand name is Zyrtec. So the dose of this is going to be 10 milligrams by mouth daily with a max dose of 10. Okay, I want to stop because. So the next second generation oral antihistamine that we will go over is cetirizine, which is the generic name, and the brand name is Zyrtec. So the dose of this drug is 10 milligrams by mouth once daily, and the max dose of this drug is going to be 10 milligrams per day. Side effects are going to be dry mouth, headache, drowsiness, fatigue, and sedation. And you want to avoid any other central nervous system depressants because sedation can occur with this medication, even though they're not supposed to cause sedation, this class of medications. This drug comes in tablet formulation, liquid-filled capsules, as well as disintegrating tablets. The next second generation oral antihistamine that we will be going over is levocetirizine, which is the generic name, and the brand name for this drug is Xyzal. So the dose is going to be 5 milligrams by mouth once daily in the evening, and the max daily dose is going to be 5 milligrams. Some side effects that can occur are constipation, diarrhea, vomiting, dry mouth, and sore throat. Caution with this medication is that you should avoid alcohol or other central nervous suppressants because sedation can occur even though the drug is not formulated to have sedation. Drowsiness, fatigue, and weakness can affect mental alertness and motor coordination, so be aware of that. This drug comes in tablet formulation as well as an oral solution. The next second generation oral antihistamine that we will be going over is fexofenadine, which is the generic name, and the brand name is Allegra. So the dose of this medication is 60 milligrams twice a day or 180 milligrams by mouth once daily with water. Some side effects that can occur with this medication are stomachache, backache, dizziness, headache, fatigue, pain in your limbs, as well as drowsiness. So some cautions for this medication is the use of aluminum or magnesium-containing antacids within 15 minutes of the use of the medication. Also, the consumption of fruit juices such as grapefruit, orange juice, and apple juice while also taking this medication. This drug only comes in one formulation, and that's tablet form.
So intranasal corticosteroids are the first-line treatments for allergic rhinitis. They work by reducing the inflammation caused by your body's immune system. It can take a week or two of regular use for best effect. so it's important to start taking them at least a week before allergy season. Possible side effects include dry nose, sneezing, headache, sore throat, and nosebleeds. It's important to note that they can slow down the growth of children if used too frequently. So there are 4 intranasal corticosteroids that are available over the counter. Triamcinolone, known by its brand name Nasacort, fluticasone furoate, known by its brand name Flonase Sensimist, fluticasone propionate, known by its brand name just Flonase, and budesonide, known as Rhinocort. So for ages 12 and up, the instructions are the same for each of them. 2 sprays in each nostril once daily, then reduce to 1 spray in each nostril once daily when symptoms improve. However, they each have different cutoff ages. For Nasacort, you don't use it in children less than 2 years old. For Flonase, it's children less than 4 years old. But for Flonase Sensimist, the cutoff is 2 years old. And for Rhinocort, you don't use it in children less than 6 years old. Between the cutoff age and age 12, the instructions are to just use 1 spray in each nostril once daily. There is also intranasal cromolyn, known as, by its brand name, Nasal Crom. You use 1 spray in each nostril 3 to 6 times per day. And like the others, it may take a week or 2 to see improvements. The side effects of nasal crom include sneezing and burning of the nostrils.